Greetings. Let us learn about diverticulosis of the colon. So diverticuli are mucosal outpouchings or mucosal herniations through the wall of the colon, and if they are bland without inflammation, these outpouchings are referred to as diverticulosis, and with inflammation they are known as diverticulitis. So diverticulosis is without inflammation, and diverticulitis is when the diverticuli get inflamed. Majority of the Western population tend to have diverticulosis of the descending and sigmoid colon by the time they reach their 50s and 60s. In contrast, Asians could have diverticulosis on the right side of the colon instead of the left side of the colon. So now let us look at how do you identify diverticulosis when we perform either a sigmoidoscopy or a colonoscopy. So here the endoscope is in the sigmoid colon, or you could say our descending colon, and you see these small outpouchings, small, medium, a little bit bigger, and very large outpouching. And these diverticuli are empty, while these diverticuli are filled with fecal material, otherwise known as fecoliths. Majority of the time, these diverticuli do not cause any symptoms, but once they become infected, then you will see signs of inflammation or diverticulitis. Here you can see a pocket of diverticulum extruding pus, that is infected and extruding pus, and surrounding that area you could see inflammation and swelling, and the lumen has become a little bit smaller. Let us talk about Hinch's classification, and this is important for surgeons to decide the type of management when a patient presents with diverticulitis. There are 4 stages. Depending upon what happens to the inflammation of the diverticulum, whether an abscess forms and how big does it become, does it go into the pelvis, or does it rupture and cause free peritonitis, or rupture and release fecal contents into the peritoneal cavity. So depending upon that, in stage 1, the abscess is limited to the mesentery. In stage 2, the abscess becomes bigger and extends into the pelvis. In stage 3, there is a free perforation and pus contaminates the peritoneal cavity. In stage 4, there is free perforation and fecal matter enters the peritoneal cavity. Stage 3 and stage 4 require surgery because of free perforation and contamination of the peritoneal cavity. Stage 1 and stage 2 can be managed medically with antibiotics, and in some cases you could also request interventional radiology to place a drain to drain that abscess. And once the patient recovers from the diverticulitis, the surgeon could decide about the type of surgery and the timing of surgery, and taking into consideration overall health, whether a surgery should be done or not. I hope this is useful. Thank you.